Good morning, everyone, and thank you so much for tuning in. So today I will be presenting research on supporting the mental health of farm families in the US Midwest. And this work was very much a collaborative effort with my colleagues Carrie Henning-Smith and Andrea Alberth at University of Minnesota, Shoshanah Inwood at The Ohio State University, Andrea Bjornestad from South Dakota State University, and myself, Florence Becot at the National Farm Medicine Center. And this research was funded through the North Central Regional Center for Development, which is based at Michigan State University. So globally, we've known for quite some time that agriculture is one of the occupations that experiences some of the highest stress and depression levels. And it is also one of the occupations that experiences some of the highest suicide rates. In the US, farm and mental health professionals began to raise alarm rates over increasing rates of stress and depressions due to the current farm income crisis. And then more recently, with COVID-19 creating massive and sudden economic, social, and political disruptions, we're also already seeing signs of exacerbated and compounded existing stress. But in reality, the current pressures are combined with long-term trends that are exacerbating mental health issues in the farm population, while at the same time making it more complicated and delaying a rapid response to these very needs. And so some of those long-term trends that have been discussed at length in the literature and that have a direct bearing on not only farmer mental health, but their ability to meet their health needs are connected to the aging and shrinking of the farm population, both changing structure of agriculture and rural communities, the investment in rural healthcare systems, inadequate number of mental and behavioral healthcare, as well as health insurance and high healthcare cost. So turning to the literature on farmer mental health, there's been actually a long-standing interdisciplinary and international body of research that has looked at the origins and type of mental health stressors, how stressors manifest, and coping strategies. And what is interesting is when we look at this literature across time and across space, there are actually quite a few similarities in terms of what are the challenges and then how are stressors manifested. But more recently, there has been expansion of this literature to look at variations across age, gender, and commodity produced. And I think this is really speaking to the idea that the farm population is now homogeneous, and we need to think about how different parts of the farm sector and also how different individuals within that sector are impacted and responding. So at the same time, what this work has been done, this work has largely been done from the perspective of farmers as the unit of analysis. And we have more of a limited understanding of the perspectives and experiences of agricultural and mental health service providers. Yet, these providers are on the front line working in a diversity of capacity to support the mental health of farmers and their families. So in some cases, we are talking about, let's say, agencies of agriculture that are collaborating with farm commodity groups and extension services to look at what can we do about the current issue. But we're also looking at healthcare professionals who are seeing farmers coming into their offices dealing with some challenges. The other one is in response to farmers' mental health needs. And this is because several researchers have recently pointed to the notable knowledge gaps in response to farmer mental health needs, and at the same time, a lack of understanding of resources that might best relieve mental health stressors. And I will say that from what we can see, most of that work dates back to the 80s farm crisis and from outside the US context. But in reality, there is a need to build a body of knowledge of the programs and policies in a diversity of contexts that support the health and well-being of the farm population, but also that can act as a buffer in times of crisis. And I think the idea is not necessarily to say, let's look at what others are doing and copying exactly what they're doing, but more understanding what are the different institutional arrangements that might make it that we are better able to support farmers. So this is where our research comes in, looking at supporting the mental health of farm families in the 12-state North Central region. Our research questions going into this research were pretty straightforward. What are the challenges faced by Midwest farmers? How should we address their challenges? What type of supports are available? And what are the practical implications and avenues for future research to address the remaining gaps? And we went about this research through two main activities: came from interviews with subject matter experts, an online environmental scan of farmer resources. So speaking to our methods quickly, we conducted key informant interviews with 19 subject matter experts from a diversity of sectors, ranging from mental health providers, research, state agencies and state extension, business, and farmers. And I will point out that some of the folks that we interviewed wore more than one hat. And so, for example, it might be an extension agent who is also a farmer. We conducted content analysis, which led to 4 domains. And today, for the sake of time, I will not cover coping strategies, but I will say that there are most of those coping strategies reported by the folks that we talked to were negative strategies. Then we also did an environmental scan, searching for resources, services, and educational materials in 12 states. And basically what we did is we came up with a list of search terms, and we associated each of the search terms with the target population and the state. And all the documents that we identified were saved, and we developed a typology to organize them that included delivery format, audience type, and type of support. And today we'll fly pretty quickly through the findings of the online environmental scan, but I invite folks who are interested to look at our publication in the Journal of Extension, where we presented this work last year. So I am now going to present the findings of our research, starting with key informant interviews and the discussions around challenges faced by Midwest farmers. And the way that we're organizing the presentation of these findings is along a continuum starting from micro level, where farmers have the most ability to influence, all the way to micro level, which they have the least ability to influence, but which directly shapes health and well-being. So finances is one that came up over and over again, and it was discussions connected all the way from debt, mortgage levels, how much debt farmers have, all the way to trades, tariffs, and commodity prices. Connected to finances oftentimes was farm planning. It was not only in terms of employee management, hired workers, and family members, but it's also around changes over time and uncertainty, which is the idea of like, how do I plan for next season? What type of market should I go? And what does that mean for the long term of the farm operation? And speaking of the long-term outcome of the farm operation, key informant interviews brought up concerns connected to the legacy of the farm and generational differences. So in some ways, there are disagreement between older and younger generation about what can be done with the farm. But essentially, those are discussions connected to what will happen to the farm in the long term, who is going to take it over, and actually, is there anyone to take it over? Healthcare access was, of course, an important discussion considering that we're looking at farmer mental health. There were a lot of discussions around provider shortages, proximity to care, and this is something that very much echoes the previous literature because farmers tend to live in rural areas where access to healthcare might not be as good. You know, the more rural you are, usually the less easy it is to access. In the US, we also must contend with insurance issues. So this is something that has not come up, that I have not seen as much in the literature, let's say, coming out of Australia or Canada or France, because those are countries that have access to universal health insurance. And it is not to say that everything is perfect, that there are not issues, but I think that in the US, those issues are a lot bigger. And last, it's thinking about the weather. And the idea is that weather has always been unpredictable. It's always been variable. But what we heard around among the key stakeholders is the worries around what are changes associated with climate change going to do with the mental health of farmers, when some research is already showing that it will increase the stress level of farmers. The next thing that key informants talked about was the diversity of farm population. And they talked about variations on the basis of individual and household farm operation variations. And this was really important for them. For them, these differences are important to consider because they mean different challenges in terms of needs, coping strategies, and solutions. And so that really emphasized the recent expansion of the literature that has spent more time looking at differences, let's say, in terms of age or in terms of gender. And I think that as we think about these differences in what we've long known a heterogeneous population, we also need to think about not only how those stressors manifesting themselves, which likely leads to different solutions potentially. But also, one thing that we must think about is who should serve these different populations. And I'm saying that in particular in light of the research that has been done on extension service provision and some of the findings around groups of farmers that have felt that in the past they have not been served well by extension. And that includes in particular women and minority farmers. So the last set of questions that we had for key informants was around ways to address challenges faced by farmers. And the key informants talked about solutions that we categorize in three main categories: education, access to care, and addressing root causes. And so education was very much about directly tackling mental health, both in terms of providing more knowledge in terms of what is mental health, how does stress manifest itself, what are signs of suicide, and then also connecting farmers to resources. And so the idea is also to reduce stigma around mental health issues so that more people more and more talk about it. Access to care was directly about making sure that farmers have the resources that they need to get professional care. And so that is done through increasing providers in rural areas, mental health providers, in particular with knowledge in rural and agricultural knowledge. That was also around crisis line and mobile crisis unit. And that was also about more broadly about the healthcare system, integrated care, and access to affordable health insurance. The last piece of ways to address challenges was seen as addressing root causes. And so that includes things like financial and succession planning, which we have known creates a lot of tensions among families. It was also about talking about, are there ways to support farmer income or to increase farmer income through diversifications? So that might be diversification of what farmers produce and markets they sell to. And then there was also root causes around countering loneliness, and the idea that with isolation comes more time to think about challenges. And then last, there was about addressing structural issues and the underlying stress. In the next 3 slides, I will present the findings from the environmental scan. Looking at the types of programs available, we found 121 different programs with 162 individual components. Fact sheets, web pages, workshops, and conferences were the types of programs that were most often available, and those tended to present information on what are the stressors, sources of stressors, how to recognize them, and then what to do about it. And the programs that were least often available, and this is likely connected to the amount of resources that they require, both financial and in terms of time, were in-person counseling and hotlines. Turning to the target audience for the programs available, about 2/3 of the programs were targeted at farmers and farm families, and less than 10% were targeted to service providers. And the programs for service providers that we found were programs such as first aid, mental health training, so that service providers are equipped with the tools when they work with farmers. So looking at the delivery methods of programs available, over half of the programs were categorized as self-help. So those are programs that are intended for farmers to use and to gain information. Mediated help, on the other hand, about 1/3 of programs were mediated help, and this is where farmers have access to somebody, to some kind of expert to work them with something. So that might be a behavioral health, or that might also be a financial advisor to help working through books. So now we compare the findings from the key informant interviews with the findings from the environmental scan. In terms of education, we found that most of the existing resources fall under that category of education, which is something that key informants talked about when we talked to them. They said that they felt that at this point, most of the resources were targeted towards this. So with the majority of programs being self-help and some training for service provider, the idea here is that those programs are likely efficient, low-cost means of reaching farm families, and in the long term, they might help towards the goal of reducing mental health stigma and increase awareness. The other piece was about access to care. So that is what experts recommended. We need to increase access to care, And so many of the resources are in some ways directly or indirectly about linking farmers to help. But when we look at some of the offerings around not only the fact sheets or conference workshops, but also when we look at crisis lines, so they might not offer sustained help in the long term, in particular for more serious mental health. And the one piece that we did not find was really resources connected to health insurance, and even discussions on how farmers can check their health insurance plan to see make sure that they're covered. And in research that I did, that we've done, part of the team has done on health insurance for farmers, we found that about half of the farmers did not know if their health insurance covered mental health. So the last piece was about addressing root causes, and that's clearly going to be the hardest thing to do. So we found that root causes were often mentioned in material to explain challenges, but these are the ones where, based on the existing resources, they're not addressing underlying structural issues. And I think the explanation is pretty simple. Addressing these root causes will likely take policy changes. So in the last slide, I will talk about practical implications and future research. And so we categorize those in a similar way that we did with challenges, from the easiest, less controversial, to the hardest, most controversial. So starting with education, one very practical implication is about providing information on health insurance and telehealth on any type of resources around farmer mental health. Because I think that if we're going to tell farmers to go see a provider, we need to also to be cognizant that this has a cost and that it is a barrier to care. There is also opportunity to provide information on resources to link farmers to financial support. And last, while doing this two thing might help in the short term with providing more help, in the long term it might also help decrease stigma connected to both seeking mental health help but also financial help. In terms of access to care, there is a need for training for healthcare and agricultural service providers, and this is training that is being worked on by some colleagues. And then kind of connected to that too is, as we're putting a lot of resources to increase access to care and helping farmers with mental health challenges, there is a need to talk about sustainability plan for resources. That is, once the crisis is over, what do we do to make sure that all the things that have been developed stay in place, considering that crises come and go, but also that farmer mental health issues are chronic? And last, it will take policy intervention, but there is a need to increase mental health coverage, and there's also a need to assess and retain recent changes in telehealth. And when we talk about recent changes in telehealth, we're talking about the ones that came about with COVID-19 a couple of months ago. So last, how do we address root causes? So there is a need for resources that are targeting at meeting households' financial needs, and some of these are already available. It's things like such as Medicaid. It's things such as tax credits for health insurance, and also tax credit for childcare. But really, the bigger conversation that needs to happen, and maybe that is where researchers have a role to play in providing evidence on what we can do on the factors, on what we can do to support the mental health of farmers, is to talk about the intersection between the agricultural economy and policies and farmers' mental health. So that was all I had for today, and feel free to reach out with any questions or comments.